Hepatitis C Antibody Anti-HCV Test. 1. Introduction. Hepatitis C virus HCV infection is a blood-borne viral disease that primarily targets the liver, leading to acute and chronic hepatitis. Globally, more than 58 million people are chronically infected, and complications such as cirrhosis and hepatocellular carcinoma (HCC) cause significant morbidity and mortality. Since the disease may remain asymptomatic for decades, early detection through laboratory testing is crucial. The Hepatitis C Antibody Test is the most widely used screening test to identify people exposed to the virus. 2. Definition. The Hepatitis C Antibody Test, commonly called Anti-HCV test, is a serological test that detects the presence of antibodies against hepatitis C virus in the blood. It does not detect the virus itself, but the immune response to it. A positive test indicates current infection, past infection, or cleared infection, and requires confirmation with HCV RNA PCR to detect active viremia. 3. Indications. The test is recommended in the following situations: clinical suspicion, symptoms, signs of liver disease, jaundice, fatigue, right upper quadrant pain, hepatomegaly. High-risk exposure, intravenous or intranasal drug use, needle stick injury in healthcare workers, blood transfusion, organ transplant before 1992, before donor screening began. High prevalence groups, people in endemic regions, prisoners, or those with multiple sexual partners. Medical history, HIV or HBV infection, chronic kidney disease on dialysis, history of tattoos, piercings with unsterile equipment, maternal transmission, infants born to HCV-positive mothers, routine screening, blood organ donors, pregnant women in some countries, individuals born between 1945 to 1965, baby boomer cohort with higher prevalence. Used for screening to identify individuals exposed to HCV, diagnostic aid, in combination with confirmatory RNA test. Epidemiological studies, helps measure burden of disease in a community. Pre-treatment evaluation, establish baseline before antiviral therapy. Public health control, prevents transmission by identifying carriers. Number 5. Why do need of this test? Hepatitis C is often called a silent infection because symptoms are absent until advanced disease. Detecting antibodies helps identify infected but asymptomatic individuals. It prevents progression to chronic hepatitis, 70 to 85%, cirrhosis, 20 to 30%, hepatocellular carcinoma, 1 to 4% per year in cirrhotics, identifies patients eligible for direct-acting antiviral DA therapy, which has 95% cure rates. Number 6. What happens during the test? A healthcare professional collects a venous blood sample, usually from the antecubital vein. Serum is separated and analyzed in the laboratory. Testing methods include enzyme immunoassay, EIA-ELISA, most common, chemiluminescent immunoassay, CLIA, highly sensitive. Rapid diagnostic tests, RDTs, fingerstick point-of-care tests. How long for my results? Routine lab-based results, 1 to 3 working days. Rapid test kits, 20 to 40 minutes. 8. Preparation for this test. No fasting required. No specific dietary or medication restrictions. Inform your physician about recent exposure risks, immunosuppressive therapy, past infections or autoimmune disorders may cause false positives. Number 9. Risks. The test is generally safe, but minor risks include local pain, redness or bruising at venipuncture site, rare fainting or dizziness, extremely rare, local infection at puncture site. 10. Normal values. Negative, non-reactive, no anti-HCV antibodies detected. Positive, reactive, anti-HCV antibodies detected, requires confirmatory testing. Indeterminate, borderline results, repeat test or use different method. M11. Interpretation of results. Negative result, likely no infection. Could still be in the window period, up to 12 weeks post-exposure. Positive result indicates exposure to HCV at some point. May represent current infection. Past, resolved infection. 15 to 25% of people spontaneously clear the virus. False positive, rare. Requires HCV RNA PCR or HCV core antigen test for confirmation. Indeterminate result. Repeat test after 2 to 4 weeks. Consider confirmatory testing immediately. Number 12. Factors affecting results. False negatives. Testing too early before antibodies develop. Immunosuppression, HIV, chemotherapy, transplant patients. False positives, autoimmune disorders, lupus, other viral infections, cross-reactivity in some assays. Number 13. Clinical significance. Public health importance. Early detection reduces transmission. Clinical relevance. Guides further testing, HCV RNA, liver function tests, fibrosis assessment. Treatment planning. Identifies candidates for curative therapy. Disease burden reduction. Prevents cirrhosis, liver failure, and hepatocellular carcinoma. 14. Know more. Antibodies appear about 6 to 12 weeks post-infection. Once positive, antibodies usually remain for life, even if the virus is cleared. HCV RNA PCR is the gold standard for diagnosing active infection. The WHO recommends one-time testing for all adults and periodic testing for high-risk individuals. Treatment with direct-acting antivirals, DAAs, can achieve cure rates of 95% within 8 to 12 weeks. Now 15. Conclusion. The Hepatitis C Antibody Test is the first-line screening tool to detect exposure to HCV. While it is simple, inexpensive, and highly sensitive, it cannot distinguish between past and current infection. Therefore, all positive results must be followed by HCV RNA testing to confirm active disease. Early detection allows timely treatment, prevents progression to cirrhosis and liver cancer, reduces transmission, and contributes to the global goal of eliminating hepatitis C as a public health threat by 2030, WHO target. This is a detailed professional version. Thank you. Have a nice day.